And so we'll now move to our first panel, our only witness, and that's the Honorable Steve Kagen, a gentleman from Wisconsin and the sponsor of H.R. 4700, the first bill on our agenda. I just want to thank him. He, as you know, is a physician. He has been very aggressive in pushing this transparency issue, both with me and other members. To his credit, we all think it's a very important issue, but I think that without his pushing us, we wouldn't probably be here today. So thank you, Congressman Kagen. You recognize.
Thank you, Mr. Chairman. I couldn't agree with you more about your opening remarks about why we're here. Thank you for holding this meeting. Thank you to Chairman Shimkus, Ranking Member Shimkus, and Chairman Emeritus Dingell, who could not be here this morning. Thank you to all members of this subcommittee for joining us in this very constructive conversation about transforming our healthcare system and creating a very competitive medical marketplace. I am Steve Kagen. I've lived in Northeast Wisconsin for my entire life, and before becoming a member of Congress, I practiced in a privately owned and operated medical clinic throughout Northeast Wisconsin. I've also served in VA hospitals for 3 decades, so I understand both a government-run situation and a private system. Today you're going to hear testimony from a number of expert witnesses on the importance of establishing a transparent medical marketplace to help to guarantee the highest quality care becomes available to everyone at the lowest possible price. We're very fortunate in Wisconsin to be leaders in health care, making progress in guaranteeing that there is quality measurement, not just within the hospital institution itself, but also on the Internet, as you'll hear from the CEO of Theta Care Center for Healthcare Value, Walt Rugland. As every member of this subcommittee already knows, health care in America is upside down. When someone with no insurance gets sick and goes to the hospital gives you the big bill. But if someone else goes to the hospital and has insurance, they get a discount. Health care is upside down. This takes place each and every day in my district and every district of the members of this committee and the members of every one in the House. While the passage of our nation's health care security law earlier this year will help to guarantee that no citizen will lose their home or go broke just because they become sick, it needs to take another step and to guarantee that everyone can see the price of everything they're buying at all times, most especially beforehand. Competition is a good thing. Indeed, it's an essential element of capitalism. And when there's a level playing field, competition will drive quality up and prices down. Everyone knows that the listed prices for medical services are meaningless, for the real price is being hidden. Therefore, prices our constituents pay for insurance coverage, for prescription drugs, and for hospital and doctor bills are, quote, whatever they can get. Take, for example, the recent article that appeared in the LA Times on April 24, 2010. And you can see this slide before you. And I'll quote from that article. Tom Taylor learned a lesson about health care finances when he had both his knees replaced a couple months apart at several hospitals in Northern California. The tab for the first hospital was $95,000, but the second cost $55,000. The same doctor performed identical surgeries on both knees. And Taylor says he can't detect any differences between the two. Quote, Mr. Taylor, nobody knows what it costs. There is a complete lack of transparency in our healthcare system, close quotes. Well, here in my hand, I have a prescription. And everybody understands today that if we all have the same prescription for the same medication and go to a pharmacy and stand in line, we may all pay different prices for the same prescription our doctor has ordered. This has got to come to an end. We have to have open disclosure of all prices all throughout healthcare. Now, some people will make the argument that average prices for medical products and services should be available publicly. But who among us wants to receive average care? And who among us wants to go to the store and get the average change when you pay for your restaurant bill? Some will argue that showing everyone all the prices is too complex, for there are thousands of prices at any given hospital. But today's technology allows all of us to go online, on the Internet, and search for items to purchase and find exactly what we want and buy it within milliseconds. Some will argue that a hospital cannot know in advance what to charge you for taking out your gallbladder. Well, we only have one gallbladder, and there's only one reason to take it out. It's bad. So how much does one bad gallbladder cost at everybody's hospital? If you want to do something really complicated, do what I did the other day. Go into Subway. Order a sandwich. There are 2 to the 23rd power combinations of choices you have to make. And then you get to the cash register. And what do they say? That's $5 for a foot-long sandwich. If the owners of Subway can figure out how to lump things together and make a living, maybe we ought to have that same lumping idea in health care. In restaurants and in hospitals, lumping makes more sense than splitting. We've made great progress together this year, and as I heard from all of you in your opening statements, you're in a very cooperative and bipartisan manner right now, and I appreciate that. But we have to take the next step together. When enacted, the Transparency in All Healthcare Pricing Act of 2010 will guarantee that any individual or business entity that offers healthcare products or services for sale to the public must at all times openly disclose all of their prices, including on the Internet. And doing so will help to establish a very competitive medical marketplace, allow families to find the essential information necessary to make their healthcare decisions based upon the quality, the price, and the services being available not only in their hometown, but across the nation. We all believe in transparency, and so does President Obama when he said, quote, "Transparency promotes accountability," close quotes. Without transparency in all healthcare pricing, there will continue to be opportunities for fraud and market manipulation, much like occurred on Wall Street in the financial meltdown. We can fix our healthcare system and improve on what we already have done by working together. So let's create a competitive medical marketplace where all the prices we pay are always openly disclosed, including on the Internet. Thank you, Mr. Chairman, for holding this important hearing, and I very much look forward to the testimony of Walt Rugland, who has not only devised a way of taking care of patients in a more economical fashion by lowering the overhead at his hospital, but has also increased the quality with 0 medication errors in an entire year. It's not a theoretical process. They've actually done it in Appleton, Wisconsin. I thank you and yield back the additional minute I took from you.
Thank you, Congressman Kagen.